In 1997, the National Patient Safety Foundation was formed with the mission of creating a world where patients and those who care for them are free from harm. Today, some studies suggest that medical errors are the third leading cause of death in the United States. Harvard professor Dr. Lucian Leape is a longtime foundation leader who has dedicated his life to the improvement of patient safety.
It's always a work in progress. You never achieve perfection, particularly in healthcare, which is constantly changing. We'll always have problems in patient safety. The problems are there forever for the simple reason that healthcare keeps changing.
Dr. Leape helped to forge new ground with the 1999 Institute of Medicine Consensus Report entitled "To Err is Human." It thrust patient safety into the national spotlight. The report estimated that 98,000 people die each year due to medical mistakes. This shocking statistic drew the media's attention.
The television networks ran with the nightly news. The idea came up that what we really need is to have some people who step back and take a bigger look at where we're going and do strategic planning.
In 2007, the National Patient Safety Foundation formed the Lucian Leape Institute as a think tank charged with providing a strategic vision for improving patient safety. The Institute works to identify new approaches to improving patient safety, calls for the innovation necessary to expedite the work, and encourages key stakeholders to assume significant roles within the advancement of patient safety. Since its inception, the Institute has acted as a convening body for these key stakeholders.
What we have done from the very beginning is made sure that every roundtable has on it the targets of our effort, the people who will be the ones who will implement the recommendations.
Dr. Gary Kaplan is a National Patient Safety Foundation board member and a long-standing member of the Lucian Leape Institute. In 2015, he became the chairman of this group of multidisciplinary experts and thought leaders. He has been a key contributor to the organization and a strong supporter of its goals. He has acted as co-chair for multiple roundtables hosted by the Institute.
We tap into their expertise and understanding. And so in those ways, we work to stay abreast of what's happening in the field of patient safety and also to continue to foster and stimulate innovative improvements.
Gary and I share a very strong belief that the key to everything we want to do in safety is leadership. And we have been talking about that since the Institute was formed, and we have decided that we really need to focus laser-like, as people say nowadays, on the leadership issue.
It's not about surveys or focus groups, but rather it's about how do we create the deep engagement that allows us to truly be partners in the patient care experience and to engage patient and families in the important role that they can play in making healthcare safer. We're fortunate at the Lucian Leape Institute to have members who are very active, most often in leadership roles in their own organizations.
Dr. Tejal Gandhi is the president and CEO of both the National Patient Safety Foundation and the Lucian Leape Institute.
NPSF has always been a big tent, and we bring together patients, families, healthcare providers, vendor organizations, hospitals, healthcare systems, where everybody works together to create and disseminate best practices in patient safety. But also when you think about improvement work in hospitals, physicians need to be leading the charge on that and need to be team members that are very comfortable working with others to do quality and safety improvements.
In 2009, the founding members of Lucian Leape Institute identified 5 transforming concepts that were essential for the transformation of quality and safety in healthcare organizations. These concepts were presented in an article originally published in Quality and Safety in Healthcare, now BMJ Quality and Safety, and include medical education reform, care integration, consumer and patient engagement, workforce safety, and transparency.
These 5 concepts are essential to the culture change that needs to happen in medicine, in healthcare, and that we needed to really focus in on these and help people understand them better.
The Lucian Leap Institute set out this plan for having 5 reports in 2009 as the aspirational transforming concepts of how we're going to really advance patient safety. Reforming medical education, care integration, patient engagement, workforce safety, and transparency are as critical now as they were then, but now we understand even better, hopefully, how to actually make progress in those areas.
The goal of the Institute is to improve patient safety through culture, process, and outcomes. The executive summaries and associated recommendations of the 5 reports are now being released in a single document, with a focus on dissemination to leadership. The National Patient Safety Foundation's Lucian Leap Institute partners with like-minded organizations such as the American Association for Physician Leadership to disseminate the recommendations of its reports.
As I think about the compendium that's being released, that really reflects on the work of our 5 roundtables, white papers on the 5 transforming concepts, each of the white papers that will be featured in the compendium have specific recommendations. And so I think we need to take those recommendations seriously.
I would think that leaders would take away from this report the need for them as leaders to take responsibility for and make sure it happens, that care is coordinated, and that patients have a seamless experience from the first time they come to see the doctor all the way through all of their care. You can't give safe care if the care is chaotic.
Patient safety is a public health issue, and the National Patient Safety Foundation's Lucian Leap Institute is setting a strategic direction on how to advance our progress and create a world where patients and those who care for them are free from harm. This begins with capable physician leaders.
Without physician leadership, we will not be successful in establishing the culture, the cultures in our organizations that will be necessary in order to truly create safe care for our patients and our families. We intend to focus aggressively on culture and leadership. We'll do this as a Lucian Leap Institute. We'll do this as part of the National Patient Safety Foundation, and we'll do this in, I think, creative partnerships with others across the industry and beyond.
Every innovation, every new drug, every new device, every new procedure carries its own new inherent risks that we're not familiar with, and we're going to have to discover those and deal with them. So it's a never-ending quest, but we need to raise the baseline up about 90% to where we have a culture that is able to deal with these new challenges